The fifth meeting of the National AIDS Program Managers and Key Partners took place in March in Trinidad and Tobago. The presentations, discussions, and activities revolved around the theme, Strengthening the HIV Response. Caribbean to Zero sat down with program managers, key partners, and participants in an effort to keep the conversation alive, with emphasis on the continued strengthening of the HIV and AIDS response in the Caribbean.
What are some of the challenges that you face via Live Up, the Caribbean Media Alliance, when it comes to getting that message across to population Caribbean and the importance of getting tested and knowing your status, and if you are positive, at least getting treatment, etc., etc.?
Right. I think because it is a regional initiative, it's a public-private partnership that allows the ministries and departments of health across the Caribbean through PANCAP to work in partnership with the private sector, which is Scotiabank, and both public and private media houses, who are our members, 112 of them in 24 Caribbean countries. The initiative initially was just to raise awareness, to reduce some of the stigma associated with getting tested. And we've seen that exponential growth from 6 countries in 2008 and 2,300 people being tested to over 20,807 in 21 countries last year in 2016. But the issue of stigma remains. We still do not have a face to HIV as an epidemic. We still find that there are key populations that struggle and stay underground because they don't want to go to the official clinics because they're not sure if their neighbor who works in that clinic will tell their families, etc. And what this means, especially with the increasing reality of self-testing, is that we have people who will almost disappear. We don't know how they're going to respond if the test is positive. Whereas with public, well-managed, confidential, voluntary counseling and testing, you are counseled before you get tested and after you're tested. So if you're negative, you're advised on how to stay that way. What are some of the things that you can continue to do? If you're positive, the objective is to ensure that people are immediately linked to care. And the earlier the intervention, the better. Our men continue to be laggers in this regard. Women will more readily come forward to be tested, but our men are still reluctant. So the later you present to be tested, the greater your chance of developing full-blown AIDS. But I think for the Caribbean, the stigma is really still way too strong.
Delcora, as program manager for HIV/AIDS in Antigua and Barbuda, what are some of the positive results you have seen coming out of this program, especially since you've been program manager since, 2009?
Yeah. Well, I think one of our biggest success programs is actually our prevention of mother-to-child transmission, where we have over 7,000 women testing within 2010 to present. We have identified 58 of them being HIV positive, but out of that we've only had 2 babies being born HIV infected. And so I think that is like our biggest achievement in regards to the prevention of mother-to-child transmission. Another thing is to be have moved HIV testing from being a big deal, where people you have to wait for like nearly a month to get a result, to now being able to access HIV rapid testing. You get your test results in 15 to 20 minutes, which is which has allowed the National AIDS Program to now be making an impact in getting persons to know their HIV status. Because usually, even though the person might decide to perk up the courage and come, before it took so long, nearly a month, to get back a result. Now in 15 minutes you can either know your HIV status and know that it's negative and get ways to remain negative.
That's right.
as well as if you test HIV positive, we have care and treatment that is available to you right away so that you go into care and treatment, and that way you can live healthy and positively being HIV positive.
There's always the talk and then there's the walk. We're talking about the meetings and then the action that takes place after the meetings. You would have been privy to at least 4 meetings in terms of program managers, HIV/AIDS managers. From day one until now, what would you say has been the biggest accomplishment coming out of these meetings?
First of all, I'll say it has to do with the progress from each country when you listen to their report, where HIV was to where HIV is at now. And in terms of better treatment, better care, access to better health care, and those sort of things. And we have seen a reduction in HIV new cases, and the greatest achievement will be where we are now accomplishing mother-to-child transmission. So it means where you'd have had, let us say, over 10 deaths per year. Now there are some countries that is at 0. And for me, that is the biggest achievement in the fight against HIV.
We have to start looking at ourselves. We have to confront our own prejudices. We do judge people. We judge somebody if they're tall, if they're slim, if their hair is natural, if they're fat, if they're brown, if they're black, if they're Indian. So those are things that we do have to come to terms with if we are honest. I think some honest conversations need to be had, and you're helping by having this conversation here. But one of our challenges as Live Up has been persuading people. Our initial funders always wanted to fund us as a 5-year pilot, as it were, with an expectation that there would be sustainable funding beyond those 5 years. That has not happened. What we get is project funding. Now, the project has to be managed by someone, somewhere. It has to be paid. And there's a cost to the quality of behavior change messaging that we create. And I think there is a perception about the media that somehow the media has money and that the media will be there when other people want the media. And what we've tried to do in training over 2,000 media in the 10 years of our existence has been to show civil society and governments and other organizations that you really need to bring the media in from the beginning. That the target audiences that the technocrats talk about reside in media houses. I mean, a newsroom, your camera crew, there are a whole range of people, and everybody brings their personal experience and values to the table. And what I think is now missing is the kind of comprehensive cross-pollination that we used to do when our budgets were much larger, where I traveled to the region, to each country, to each media house, to meet with the staff, as well as the ministry representatives, as well as national organizations, advocacy groups, so that there was this exchange and appreciation for some of what people go through. So an NGO, for example, in St. Lucia, the AIDS Action Foundation, when I did some training there with the media houses, the principal of that, Joan Didier, she talked to them about how key populations feel. These are not bodies out there. These are somebody's children.
That's right.
Somebody's brother. And therefore, until we begin to remove those blinkers of judgment, and I dare say none of us is able to judge unless we are a higher power, that we are going to continue to struggle with the vestiges of stigma and discrimination that continue to have people go underground. And HIV is a leveler because HIV does not discriminate on whether you are rich, whether you are poor, whether you're a politician or a pauper or anything else. HIV happens when you are living. And there's no judgment about it. There are some wives that are home whose husbands may have brought it home to them. There's some very young girls who may be engaging in intergenerational sex. I mean, one of the data that we discovered at this meeting is that you have so many teenagers between 15 and 24 going out with people at least 10 years their senior. And their first point of initiation is at 15 into sexual activity at a time that they're still learning their bodies and themselves. But then we're saying the young people are wild, but who's the adult that is having sex with this young girl? Are we facing those realities? I think that's where the media is a critical plank in any work that is being done, however laudable, however impressive, by civil society and governments, because the power of the media is unparalleled. And now that we have social media, whew, it's mushroomed tenfold.
I want to take you back to when we met in Barbados. And we were looking at the 1990 targets, and I remember asking you if you felt that it was realistic, if it was possible. And you were positive about it, but you had some, you were a little bit unsure as to the direction or how it should go in order to reach those targets. We spoke about stigma and discrimination. We spoke about St. Vincent and getting health care and persons getting treatment and not being afraid. How do you feel about that now? And you talk about action and the reports coming out every single year. I am pretty sure at this stage of the game, things are a little bit better and a little bit brighter.
Yes, the stigma and discrimination we cannot get rid of. That can happen only if a country understand what HIV is all about. They need to know that HIV is practically it's a communicable disease, yes, but where persons were dying at a rapid pace, it does happen. We see where ARV is having people outlive even the healthy ones. Sometimes the stigma and discrimination, most times, is self-inflicted, where we have stigma and self-discrimination,
Yes.
where persons who are HIV infected, if they know you and they know that you know that they are HIV, and they see you look at them with somebody else, they will think that because they see two persons standing and they realize they're looking at them, they will say to themselves, he or she's telling them, I am HIV. But I must say in 1919, I still have my reservation about it, but I'm seeing it happening. I am seeing some 90s we are reaching, but there are some other countries that need to catch up, and I strongly believe that once government, our biggest problem is government not taking ownership, because once the funding agencies move out or the funds dry up, what happens after that?
Well, they will have no choice, so maybe they should jump on board at this point in time. Is that happening in St. Vincent and the Grenadines? What's your funding like?
In St. Vincent and the Grenadines, we're doing quite well. We're actually in the process of the mother-to-child transmission, and every person, we have never had stock out of ARV. Persons living with HIV has free access to any government health facility. The care and treatment is very good. We have an infectious disease doctor who's quite capable, who's a loving person. The National AIDS Director is a community person. She's now getting the community and everybody involved. And I can see St. Vincent evolving where we can be the trailblazers, where other countries come to us to ask us, how is it that we are getting it done? And then that is where we'll start doing shared information, where as an OECS, and what is most important is that the OECS has a strong, firm togetherness. And once that continues, St. Vincent can move forward and along with other countries in the Caribbean. I strongly believe that HIV will be once known, but yet forgotten.
What sort of support do you get from the government agencies in Antigua and Barbuda? Because I'm going to say now that obviously funding comes from the Global Fund, or no? Yes?
Actually,
Tell us.
yes, quite proudly, I
Tell
must
us.
say. Antigua and Barbuda is kind of a unique in the fact that when our Global Fund was coming to an end in it ended in 2010, but we had a no-cost extension to 2011. The Ministry of Health decided to put in a budgetary,
Excellent.
yes, a
Excellent.
budgetary to ensure that
So there's an allocation.
yes, a budgetary allocation for the national AIDS response.
Excellent.
And so actually our budget is about $1.3 million. And we also pay for like our viral loads, our CD4, our ARVs,
Hats off.
our condoms.
Hats
So
off to you.
we are in the present Global Fund, but it's more about the new persons accessing. So we still continue to, as a nation, to take care of our persons, both in prevention of HIV and also in care, treatment, and
Excellent.
control of HIV.
That's very good to hear. I'm very proud to hear that. Dr. Leacock, the struggle is so real though, and you talk about media. We have a major struggle. We're always uphill, and sometimes we fall down and we get back up. We look at that media blitz that took place maybe 10 or 15 years ago, where the message was always out there, and of course your agency would have been one of those agencies always pushing the message, live up.
That's right.
It's very difficult at this point in time, and I guess as you mentioned in terms of funding, but what are some of the angles that your agency would take at this point in time to,
Right.
sort of jump over those hurdles?
Well, one of the things is partnerships. They're key. If both partners have reduced budgets and they combine efforts and skill sets, you can still get quality messages that make a difference. You can still have the back end kind of training and the solid content that will allow multiple interest groups to understand that this is not a flash in the pan intervention. It simply cannot be. It always has to be an ongoing process. One of the unfortunate things, of course, is that funding patterns change and funding priorities change. What we as a region, I think, have to start to recognize is that we have to look out for our own backyard a little bit more. Instead of always depending on the kinds of budgets that we had initially for HIV. So where there are products and services that one agency has, we are prepared to work with and train people on how to create meaningful messages with the right messenger. That's a huge issue because to just say stop gender violence, nobody's going to hear that. So we have to really spend time analyzing, focus group testing, and recognizing who are the audiences that we're trying to reach and who's going to reach them far more effectively than I can. Who Michelle can reach, I can't. And so we have to be constantly reviewing and refreshing our message. HIV is a spent force for a whole generation. They didn't grow up seeing people who, before they got interventions in the 80s, had a look. It no longer has a look.
Yeah.
So I think that we have to recognize it is here to stay. We can certainly aim to end AIDS, but those who are still living with the virus will still need support. And there are still generations, and the new infections in the last 5 years have gone up. So it says to us that the work has to start afresh with a completely different approach and certainly a much stronger use of media platforms, in my view. I might be just a little bit biased in that regard, but I think certainly social media and mainstream media still have a role to play. The kinds of conversations that you are having can be repurposed for social media, and we can give people information in bite-sized pieces, because we know that most people's attention span no longer goes for a full-fledged documentary. But
3
if it
minutes.
is if it is well packaged and produced,
Yes.
with the right kinds of messages, I'm still confident that we can make progress. We made progress because initially, when we rolled out Regional Testing Day back in 2008, nobody wanted to talk to us on camera. Now we have groups of young people saying, yes, we came out, we saw the ad, and we came as a group to get tested. Couples come and get tested. And that does make a difference, because it means that through the media, we've been able to normalize the process of testing in the same way that you go and get your blood pressure checked. And what the introduction of rapid testing has also done is allow people to get their results far sooner. So it's less torturous than waiting for 2 weeks,
I know.
to get the results.
Last month, we had a consultation here in Trinidad and Tobago, faith-based leaders getting together to talk about HIV and how they can help with the 90-90-90 targets. From your standpoint, do you believe that these faith-based organizations can support and help those, especially the key populations, when it comes to persons who are living with HIV? And then taking it a step further, to embrace those, the transgender, the MSMs, not to try to change them, but to give them the support that they need.
I believe that can only happen once the pastors, preachers, or you want to call them, have an understanding of who these people are, and not look at them as a transgender or a bisexual or homosexual, but look at them as a human being who just has different preferences. And also, the LGBT community, the transgenders, and so they also have to understand that they cannot take who they are or what they represent onto anyone. So for the faith-based organization, for the churches to open themselves, the church has to first learn what is the LGBT community all about, what are these people going through, who they are, where they at, and just don't allow them to come to your church and everybody look at them, laugh at them, scorn them, but go to meet them where they at. And as they always say, when Jesus was walking with his disciples, he left them and he went on the other side, and they were wondering why he did not take them with him. And he went and met a woman sitting at the well who had so many husbands, who took everybody's husband away. But Jesus went, sat with her because he knew who she was. And right there and then, Jesus saved her. And I always believe that anything is possible, and the same thing can happen. Let me speak about the church that I go to. The church is called Glen Baptist Church, and our pastor is Sylvester King. And he is someone who's very understanding. And I remember he called me before I traveled to come here, and he said to me that he would like me to start. He's looking to see where I can use my talent to bring it within the church. So that is one avenue that is opening. The Catholic Church is doing the same thing like that in St. Vincent, and the Methodist Church as well. And I believe the churches are coming on board. It is just a matter of understanding what is the LGBT community, who these people are, because for me, everybody needs love. I don't care who you are. I don't care what you have. What is most important for me, when I look at you, I see a human being first, and I don't see anything that comes out.
Let's talk about regional testing. You mentioned audience. What are we looking at in 2017? When are we going to do this? And
Yes.
how are we going to infiltrate the masses? And I use that word infiltrate
Right.
because this is serious.
It is. Well, it's our 10th anniversary this year, so we want to do it
Already?
really, already. We want to do it bigger and better. We will be having a regional launch in Barbados, and we want to make that very big. We will launch it in May, on the 26th of May, and thereafter we will roll out a month-long radio and television and social media campaign, and the actual testing day will be June 30th. What we have seen in recent years, Trinidad has been one of the leading countries with the largest number of testing sites, over 58 you had last year. And I believe that decentralizing the testing and going out to communities has worked very well, because it means you're meeting people where they are, and it's more accessible. That's certainly what we want. And in addition to that, many countries have extended their testing periods. So as soon as we launch on May 26th, there are some countries that will roll out their testing from May right up until the end of July.
Okay.
Yeah. But the day itself is June 30th, so people should mark that in their calendars, and you will see, are you positive, you're negative, get tested and see, and you'll hear our jingle and hopefully come out and get tested. Because once you know your status, HIV is no longer a death sentence, so you can get interventions, and the ministries and the NGOs are really ramping up their treatment and care access. So I think it's
Moving
a good
forward,
thing.
inroads. Thank you so much, Dr. Leacock, and all the best in your endeavors and the Live Up campaign, Live Up Media, Caribbean Media Alliance. I'm sure you're going to see it at a local station near you, so check it out. Thanks a lot.
Thank you, and thanks to the media for their support over the years.